Parveen is fighting to save her life after losing her baby 5 months into her pregnancy. Appropriate care at the right time in the right place with the right skills could have prevented this tragedy. Her ordeal began when an unskilled traditional birth attendant failed to recognize the signs of complications. Precious time was wasted reaching the basic health unit, only to realize that there was no doctor on duty. This story is repeated countless times in countless homes across the country every single day. Punjab, home to more than half of Pakistan's population, is no stranger to this scenario. Despite successive attempts to implement meaningful reforms, service delivery in the health sector continues to face challenges. The Subnational Governance Program is working with the Government of Punjab to improve public service delivery systems in the province. The health sector is a priority area for the government. To assess the scale of gaps and needs in primary healthcare service delivery, the Subnational Governance Program conducted a study in 2 districts of Punjab, Bahawalnagar and Hafizabad. Teams of researchers and enumerators went into the field to visit local health facilities, covering the whole spectrum from service providers to beneficiaries.
लेडी डॉक्टर या बच्चों का डॉक्टर, कोई टेस्ट वगैरह के लिए लेबॉरेटरी वगैरह सारी चीज़ों का इंतजाम होना चाहिए, इमरजेंसी वगैरह.
The study, among other things, revealed that service delivery is suffering because health plans and budgets do not fully reflect the needs of people in the districts. So despite a network of rural health centers and basic health units at the community level, the state of primary health care is far from satisfactory.
बुनियादी वजह ये है कि हमारे यहाँ प्लानिंग का और बाकायदा रिसोर्स एलोकेशन का फुकदान है.
Total public spending in the sector is currently approximately 1% of the size of Punjab's economy. The issue, however, is not just how much is allocated, but how resources are utilized.
हम बजट एलोकेशन जो हैं हर साल हिस्टोरिकल बुनियाद के ऊपर उसमें इंक्रीज़ के साथ बना देते हैं, जिसके अंदर हम उस वक्त की और उस एरिया की नीड्स को कैटर नहीं करते, जिसकी वजह से वो बजट जो एलोकेट किया जाता है उसकी भी वो यूटिलाइजेशन नहीं हो पाती जो कि की जानी चाहिए.
Moreover, in many remote and underserved areas, doctors are usually not available. The skills of trained healthcare workers, including traditional birth attendants, also need to be constantly enhanced through proper training to improve the effectiveness of their roles. Access to healthcare is important. Basic health units are sometimes not located in the vicinity or catchment of nearby villages.
यहाँ आस-पास का सारा एरिया स्कैटर्ड एरिया, एक तो लोगों को आने में बहुत दुश्वारी है, बहुत मील पैदल चल के इधर तक पहुँचते हैं. दूसरा ये है कि गुर्बत बहुत है.
Lack of proper maintenance of infrastructure and facilities is causing an enormous strain on the healthcare system. Where medicines are available, the relevant medicine required for a particular disease is usually not. Based on the findings of the needs assessment, the Subnational Governance Program supported the district governments of Hafizabad and Bahawalnagar to prepare budget proposals for the financial year 2014-15 that are more closely aligned to the needs of the people. This resulted in an increase in the budget allocation for primary health in Hafizabad and Bahawalnagar, with resource allocation towards areas where needs are greatest. This is an example of responsive budgeting, which means there is more money for provision of essential medical supplies, basic diagnostic facilities and missing equipment, setting up of medical camps in areas with poor access to health facilities, provision of petrol to the vaccinators for better immunization outreach. Last but not least, training of primary healthcare staff, including lady health visitors and traditional birth attendants. Their training and enhanced skills directly impacts mother and infant mortality, as they are the first contact point for childbirth in such areas.
मैं समझता हूँ कि इस तरीके की एविडेंस बेस्ड एक्शन प्लानिंग जो है वो बहुत ज़रूरी है पंजाब या किसी और सूबे में इसके हेल्थ सिस्टम को इम्प्रूव करने के लिए और अल्टीमेटली लोगों की जो सेहत है उसको बेहतर करने के लिए.
While all the reforms will take time and results will show gradually, Responsive budgeting with effective utilization is an essential step towards better health outcomes. It is these small steps in the right direction that can give women like Parveen a better chance of experiencing safer motherhood, giving hope and faith in the journey for better healthcare.